Good morning, Mr. Farber. How are you?
I'm doing good. How about you?
Good, thank you. My name is Danielle. I'll be your nurse today. What brings you today?
Wellness exam?
Okay. Is it okay if I go over some questions with you, just to kind of help us in your care?
Yes.
Okay. Can you tell me about any medications you may be taking?
I take melatonin for when I have to sleep because I have trouble sleeping at night.
Okay. How much do you take?
About 300 micrograms every night.
Okay. Anything else that you may take?
Not really.
Okay. Any allergies to medications?
Not to medications, but I do have allergies to like pollen and dust.
Okay. Do you take anything for that?
Not really. I just kind of
just deal with it?
Yeah.
Okay. What about your past medical history? Any surgeries? Anything significant?
I had knee surgery for a car crash I was in.
Okay. How long ago was that?
Like 4 years.
What about any childhood illnesses? Anything important that you can think of?
No, not really.
Okay, none? Okay. What about your social history? Are you married, divorced?
I'm divorced and I see my kids on the weekends.
Okay. How many children do you have?
3.
Okay. What about smoking? Do you smoke?
Not anymore.
Okay. So how old were you when you started smoking?
16.
16. And how long did you smoke for?
3 years.
3 years. And how many cigarettes per day would you say you smoked?
Like 2 packs.
2 packs a day? Okay. Good thing you quit. What about alcohol? Do you use any alcohol?
I drink in moderation.
Okay,
like
so...
Once in a while I have like a glass of wine.
Okay. What about drug use? Have you ever used any drugs?
No.
Okay. What about your weight? How do you feel about your weight?
I'm not gaining any weight or losing any weight. I'm not like in a constant.
Okay. And would you say you have a good appetite?
Yeah, I eat all my meals.
3 meals a day?
Yes.
With snacks in between? Okay. What about your head? Are you experiencing any headaches or vision changes?
I do wear glasses. I'm not wearing them right now, but I get headaches quite frequently.
Okay, like when you say quite frequently, how often do you get a headache?
Like once a week.
Once a week? Okay.
Yeah.
Do you take anything for your headache?
Sometimes Tylenol.
Tylenol? And does that help your symptoms?
Most of the time, yes.
Okay. And you said you wear eyeglasses?
Yes.
Are those for distance or for near?
For distance.
Okay. When was the last time you had your eyes checked?
Around 4 months ago.
Okay, good. What about dental? Do you go and get like your cleanings done? Any issues with your teeth?
I go to the dentist twice a year, every 6 months.
For your cleanings? Okay.
Yes.
Any fillings or anything? Any loose teeth?
Yes.
Okay.
Just feelings.
Fillings?
Yeah.
Okay. Good. Any ringing in your ears? Any hearing loss? Anything like that?
No, my hearing is fine.
Okay, good. Any issues with breathing? Runny nose? Do you get like when your allergies are acting up? Do you have like a runny nose?
Yeah.
Okay, but you said you don't take anything for that.
No.
Okay. And neck. Do you ever notice any like swollen lymph glands or anything like that? Any
No.
trouble swallowing? Good. Any heart palpitations or chest pain? Anything with
My
any
chest,
problems in your chest?
no chest problems.
Okay. Stomach issues? Are you having regular bowel movements? Are you pooping regularly?
Yeah.
Okay, good. Any constipation issues or
Not often.
bloating? Nothing? Okay. If you did say you were pooping regularly, that's good. As far as like, do you do testicular exams on yourself? That's important.
Once a month.
Okay, good. What about urinary frequency? Any experience with that? Are you peeing a lot or excessively?
I'm paying a normal amount.
Okay, good. And are you drinking enough water?
Yes.
Good. Any like issues with your veins, like varicose veins? Like varicose veins means like they're sticking out and swelling out. Any issues with that?
No.
Any problems with your joints?
No.
Okay, good. What about like any experiences of depression or anxiety? Do you experience any of that at any time?
Not really.
Okay, good. Do you have a good support system, like family around that?
I do.
Okay, and speaking of your family, I forgot to ask you about your family history. What about your mom? Can you tell me about any illnesses your mom may have experienced?
My mom's pretty healthy.
Okay, good. What about your dad? Can you tell me about any past medical history about your father?
He had lung cancer because he smoked a lot.
Okay.
Like,
Is he still living?
He's alive, but he's in jail at the moment.
Okay. Did he have any treatment that you're aware of, or is he undergoing treatment while he's in the jail?
Yeah.
Okay. Is he getting chemotherapy?
Yes.
Okay. Can you tell me about your mom's mom? Is she still living?
Mm-mm.
What did she pass away from?
Natural causes.
What about your mom's dad? Can you tell me about him?
He died of colon cancer.
Okay. Can you tell me about your dad's mom? Is she still living?
She's still living and she's very healthy.
And your dad's dad, can you tell me about him? Is there any issues there?
Yeah, he's paralyzed from the neck down because of a stroke he had a couple years ago.
Okay. Any other family history that you can think of with any of your family members? What about any of your siblings? Anything important to report?
My siblings are all alive and they're all doing fairly well. They're all healthy.
Okay, good. Very good. As far as like your activities of daily living, things that you're showering, you're brushing your teeth, do you feel like you perform those okay?
Yeah.
No issues? Good. Okay. Any memory issues that you're experiencing?
No.
Any kind of pain? Are you in any pain anywhere?
No.
You had mentioned you had knee surgery. No issues with that. No arthritis or
No arthritis.
Very good. Have you noticed any like temperature intolerances?
I can take all temperatures fairly well.
Okay, so no excessive coldness or heatness that bother you.
No.
What about excessive thirst or excessive urination? Nothing there.
Nothing there.
Okay, good. Well, Mr. Farber, I really appreciate your time today. I hope you have a wonderful day.
Me too.
Thank you.